Welcome to the latest one-on-one episode, a video series from Modern Healthcare Custom Media featuring insights from leaders across the industry. I'm Maria Castellucci, a content strategist at Modern Healthcare. It's my pleasure to be speaking with Brad Brooks, the Chief Executive Officer of TigerConnect. Today, Brad will be sharing how technology can be leveraged by hospitals and health systems so clinical teams are able to communicate better. Before we get started, I want to thank the sponsor of this video, TigerConnect. TigerConnect's mission is to provide a healthcare communication solution that radically improves the way care is delivered. Brad, I'm so glad to be speaking with you today. I'm really looking forward to our discussion.
Hi, Maria. It's great to meet you, and also looking forward to it as well.
Okay, so let's start with the importance of clinical communication. We often hear about how important clinical communication is with healthcare teams to prevent medical errors and improve patient outcomes. How can technology be leveraged to improve communication among caregivers so it's seamless and accurate?
Yeah, it's a great question in the way that it is so pervasively a problem across all aspects of care delivery that on many levels, um, when you speak to health systems, they've been so accustomed to sort of poor forms or arcane forms of communication that they don't even realize the degree to which they can actually improve so many aspects of workflow, which in turn improves outcomes and lowers costs. It's one of those circumstances because it truly touches every component of care delivery, from pre-admission to admission to during the stay, a care journey during the stay, um, what happens during that care journey, during this inpatient stay, all the way through to discharge, and even out to the home or to an affiliate facility like a skilled nursing facility or whatnot. Every every stage along that journey requires communication, requires coordination, requires a lot of people in different areas having to come together, find each other, exchange information about the patient to deliver care in the best way possible. And every one of those opportunities, if you aren't leveraging technology in the best way possible, you are opening yourself up to poor outcomes ultimately, because batons are dropped. When you think about transitions of care, you think about shifts that are occurring and people not communicating across shift, people not getting data in real time to be able to take action, to be able to also coordinate across a care team. All those components are, ultimately communication driven. And what we have now is an opportunity to really leverage technology to make much more of what I would call as a seamless communication fabric across a care journey. And that's really what our whole mission is about at TigerConnect.
Okay, so seamless communication is a really great tie into the next question about the importance of the integration of this information. So, what are the risks of not integrating scheduling, alarm management, nurse calling into one system? And then, additionally, what can health systems do to integrate these disparate systems, and what are the benefits?
Yeah, also some great questions. So when you look at healthcare over the last 10 or 15 years, it's kind of been a journey in terms of IT investment of largely investing in digitization of information. So things that were in paper form, moving them into a digital form. The biggest sort of initial first wave of those benefits are the ability to allow a health system to more properly track and bill for procedures and associated revenue, which makes sense, right? That you have to keep the lights on. But the really that migration to a digitized form of a health record is actually relatively new. I just saw, actually, it's funny, an interesting tweet this morning from one of the founders of Oscar, who was saying that the life of how old really full scale adoption of EHRs is younger than even Bitcoin and the adoption of cryptocurrency. It's a relatively new
Right.
phenomenon. So, but once you have information in digital form, it doesn't actually help care coordination or what happens at the point of care until you're really moving that information to the right person or care team in the right context at the right, to take action. So it's sitting in these repositories, whether that's a EHR, a radiology pack system, a lab information system, or even a schedule is a form of digital information about who's on call. But what is happening with that information, or how are you more adeptly reaching people to be able to exchange information or get them information? And that's really where we're most focused and what we're trying to do with Tiger Connect, which is um, saying, okay, if you have people who are in schedules, that is a major component of now much more seamless forms of communication, because healthcare, what is such an enormous, almost downstream point of friction, is not only am I shifting if I'm because it's shift based in its form of care delivery, right? I start my shift. I don't know what was happening in the shift before me. Many times the information that I need to know is not necessarily in the EHR, the health record. It's actually sort of casual or unstructured information about a patient that I need to receive from the person who's in the shift before me. So that's one component. But then in addition, I need to be able to communicate with other people who also are shifting to be able to either give them information or get information. And we all sometimes need to come together as a care team to be able to exchange information, right? So all of that is really around, okay, how do you now start to bring people into roles, to personas, so that I don't necessarily know that I need to reach Maria. I just need to reach the cardiologist on call. I need to reach the third floor charge nurse. Those may be roles where you are in, and those are in turn driven from the schedule. Once I know now I can reach the role in which Maria starts her shift and then is able to receive information, now I can say, "Oh, Maria, we're creating a care team around code blue response, on door to needle response, or whatever that might be." We can now much more adeptly come together, respond to fast moving events or even events that are just part and parcel of just normal care delivery in a way that is really easy to get quick answers and to be able to take action. And so when you have people in care teams, now you have the ability to now integrate to all of that digitized data that I spoke about previously. So information, if it's a critical lab result, if it's a consult request, if it's a request for discharge, those forms of information come to you or to you as part of a care team in a much more of a seamless fashion, and work and roll over in transitions of care when you shift. So it travels with that role. All of these things, they're very particular to healthcare. It's just fundamentally the way, because a patient stays at the center and the patient's staying overnight, right? And there's multiple people caring during different shifts. But how do you kind of ensure that that information is carrying over those shifts and also being able to stay kind of integral to a care team so that everyone can take action and respond in a really coordinated and seamless fashion? And that is the role that we see around Tiger Connect, is that last mile, that seamless fabric that integrates to the data to allow for care teams and members of the care team to communicate with each other and ultimately deliver better care and save money. It's a rare kind of win-win for health systems and for clinicians and patients as well.
So everything you're talking about really hinges on the clinicians. So there's been reports of historic levels of burnout right now, especially since COVID. In what ways can effective clinical communication systems help reduce burnout?
Yeah, that's also really such an important topic around which something I'm very passionate, because I spend a lot of time visiting health systems all over the country, and I can tell you firsthand that this is a crisis of epic proportion. We have more patients who are needing more important care, especially during the pandemic, and you have um, a lot of clinical staff unfairly overly burdened with a lot of what I would call just unnecessary friction in the
Mhm.
form of how I have to spend every time. Can you imagine if every time you had to reach your colleague, you needed to go call an answering service to page them, to have them call you back? For you, it would be kind of unthinkable. You would just go on whatever your IM message platform that you have and reach them and get quick answers. In healthcare, there by and large, prior to TigerConnect, there just wasn't that capability because, again, it's coming back to some of the shift-based aspects of it and the privacy and security components. So you have a healthcare staff that's being asked to do more. They're spending a huge amount of incremental time inputting data into some of these systems like EHRs. They're being asked to handle a lot more in a more of a challenged economic environment, but they're not being given the tools to be able to get more work done more efficiently.
Mhm.
And this is kind of where we see a huge opportunity for health systems to now, yes, it's a massive challenge around the sort of things like the Great Resignation, because leading from burnout. But this is actually an opportunity to revisit a lot of kind of core workflows to give them a tool and technology that just makes things easier. And when you make things easier, you're actually restoring time back to why um, clinicians got into the profession in the first place. Nurses, I can tell you firsthand, they want to help and make patients better. Physicians want to help and make patients better. That's why they became who they were in terms of the profession they chose. But we can't arm them in a major war with 20th century essentially artillery. We need to give them what are modern tools that we all use in the rest of our lives on a consumer level, but do it in a healthcare setting where actually it really is most important. It's most vital because of all of the time aspect and the critical components of how do we kind of make patients better. So we think that it's an opportunity. It is a massive challenge. It is one that we think health systems are going to really need to rethink and confront in a deliberate way over the next several years. But we're excited because we think that we have a tool and a platform that can really address it in a meaningful manner.
I love that you talked about seeing this as an opportunity. So that's wonderful. So let's shift gears to contextual information. Can you talk about how important real-time contextual information is in clinical settings? And then to build on that, could you give us an example of a time when Tiger Connect's solutions improved patient outcomes?
Yeah. So, you know, it, contextual information kind of can span a variety of different sort of venues or sort of what I would call theaters of care. With Tiger Connect and through our middleware solution, we integrate to not only the EHR but also to the bedside, to alerts, alarms, key kinds of physiologic kinds of monitoring that a patient needs, and the ability for a care team that is taking care of a patient in an acute setting to be able to now receive those alerts and alarms in a very real-time contextual manner to their mobile device or their desktop without having to necessarily be in location. Because when you think of a care team, it can span multiple specialists who aren't all sitting around all day long around where the patient is in their room or near an ICU. But to be able to receive that information regardless of where they are, to be able to then coordinate around that information and to be able to then, take response. That is extremely powerful and really also leverages, again, coming back to some of the labor shortage and the challenges that health systems have, where you need to be able to make your workforce more efficient. You have to have them be able to handle multiple locations or be able to handle more patients in a more of an effective manner. And so, what we are about is taking that information that is contextual and bringing it to wherever they might be and allowing them to communicate amongst each other to be able to take action. And I'll give you an example of that. We're going to be releasing a study and something I'm very proud of coming out of Baylor St. Luke's in Texas, where again, here's it's an example of something where they invested in a data system to deliver information about something very important, which was stroke detection. So they have a software, an algorithmic software, where a certain number of vitals and different things that are presenting symptoms are inputted, and the algorithmic detection can say, yes, this high likelihood this patient is suffering from a stroke. Um, Now, that's great, but what are you gonna do with that information? Are you getting it to the right people, again, in the right context to take action? And in particular, when you talk about something like, stroke response, literally every minute matters. This is proven, and if they can dispense TPA, which is the, medication to address a stroke blockage, in a very timely manner, you dramatically reduce complications. You literally also reduce mortality in a significant manner. So by integrating their stroke detection software to TigerConnect, to the stroke response team that is set up and sort of standing on TigerConnect, they reduce down their stroke door to needle response time from 62 minutes on average, which is pretty much nationally kind of a normalized response time, down to 28 minutes. So when you think about that, that's almost, talking about like a 55% reduction of stroke response time. Probably saved about 75 lives last year. Um, North of seven figures of readmission reduction. Because now also, when you think about it, you've got fewer complications, because it's not just the lives that you're saving, but it's also the lives that received an intervention in a more timely manner, and therefore suffered much many fewer complications by virtue of the stroke. And those lives are tremendous, and obviously have to not revisit the hospital in as frequent as a manner. So it's again one of these circumstances where, when you marry data to a collaboration fabric in a way that addresses the healthcare workflow challenges, you've got an incredible opportunity to um, make clinicians' lives so much better, right? Because now they're acting in ways that are just more effective and efficient, which is why they got into the profession. You're reducing costs, you're saving lives, and improving outcomes. It is, and I might be overly kind of optimistic, but I think there are amazing days ahead of us because of some of these examples that I'm seeing, that they've done the investment in a lot of the digitization of information. Now this next phase is about marrying it to a collaboration layer like TigerConnect. And when you do that, I see incredible opportunity to unlock massive benefits across the health continuum.
Thank you, Brad. Thanks for sharing that. Those were some really incredible outcomes that you guys saw. So, to wrap up, would like to get your thoughts on innovation in healthcare. So, Tiger Connect is at this intersection of healthcare and technology. How do you envision innovation in healthcare in 2020 and beyond? And why must operators adapt to the digital age?
So, again, a lot of the promise of these digital investments have really, in my mind, not been realized yet. This is actually, the stage is set to really begin to realize them now. And when I talk about those examples of being able to integrate data to care teams to be able to take action, that's just even one step of the equation. Because once you begin to integrate data to care teams, now you also begin to develop more systematized approaches or cohort analytics of what are best practices and what are best standards on how to respond to like for like situations across many different health systems. The biggest challenge in healthcare, one of the biggest challenges, is just the heterogeneity of it. That, there's a joke that you've seen one health system. They all kind of operate a little bit differently and in their own way. What we're beginning to see is the ability through roles and in care teams to put people into cohorts. And then when you look at those cohorts of roles and care teams and how they interact in workflows, like that example I cited about stroke response, now you start to begin to understand, okay, this is what a great stroke team looks like, and this is the best practice of how to set up your workflow to marry this to a data system to achieve fantastic outcomes. And that to me is the next leg of the journey, which is then being able to take all the data coming out of these workflows to analyze and to make it better and ultimately propagate it across every health system, because there's no reason why every health system shouldn't be looking to operate in the best way possible by leveraging these investments they've already made, because they've all had to migrate to health records. They're all investing in different forms of data, and then the question is, well, how are you using this data? And I think that from our vantage point, we're excited because we can play a central role in helping to really use that data to learn and drive best practices and then propagating it across other health systems and other hospitals. And I think that that's really where the next leg of a big opportunity for the journey is.
Well, thank you, Brad. You've really laid out a very exciting future. So that brings us to the end of our discussion. I really enjoyed it. I learned a lot. Thank you so much, Brad.
Yep. Thank you, Maria. It's great to chat with you, and maybe look forward to doing it again.
Yeah, and we'd once again like to thank the sponsor of this video, TigerConnect. For more information about TigerConnect, please visit tigerconnect.com. And to our audience, thanks for tuning in today. Look for more one-on-one episodes in the coming months by visiting our website and our social media platforms.